Hello there. I'm going to discuss bunions briefly. I'm going to talk about what they are, what they look like, what causes them, and what you can do about it. Bunions. So what is a bunion? A bunion is a bump on the inside of the foot right at the great toe joint. So here's your great toe. This is a bunion. Sometimes people think a bunion is a bump anywhere on the foot, and indeed you can have the same thing happen on the other side of the foot. We call that a tailor's bunion, but a traditional bunion happens on the great toe joint as the bone inside the foot moves away from the rest of the foot, kind of tilts over there. How about what causes the bunion? Too much pressure on the foot, pressing the foot downward, will allow those bones, these long bones, to spread out. So often you get the bunion here and you get there at the same time as that area spreads out. So anything that causes too much pressure, like high-heeled shoes. In fact, most shoes have a subtle amount of heel. Some shoes have a very large amount of heel. That can increase the bunion. But what I'm talking about is a condition known as equinus. Equinus is when your calf muscle is pulling too hard this way, causing your forefoot to squish into the ground. And what causes that? Well, things like too much sitting or not having enough range of motion and flexibility in your ankle joint. So how could we treat? Anything that puts the equinus to rest. Sometimes you can get forefoot pressure also from a condition called pronation or excess pronation. So anything that addresses the equinus or pronation before surgery would be fine. But if that bone is already moved way out here and you have a lot of pain, then what we'll do is reposition that bone by fusing the joint that's right back here and pushing that back. And that's important because as the bone moves over, it also moves up in response to that excess pressure there. So if we can get that bone back over to its right spot and put it back down where it belongs while addressing this, then you're good. So the conservative and surgical treatment options will try to address both of those things there. So once again, what is a bunion? It's a bump on the inside of the great toe caused by the bone moving over from equinus or pronation, and the treatment is to surgically fuse this, or you can get a splint to move that toe over a little bit and push that bone in, stretch out your calves, and strengthen your foot, or get some insoles to help with the pronation. So stretch your calves or insoles / strengthen. How do you strengthen that tendon in there that holds your arch up? Well, one way to do it is to do something called heel raises, where you pop your heel up off the ground as high as you can, and at that last little bit is when your heels will come together. So, heel raises. So bunions are pretty common. In fact, I just read on Medscape that about 23% of people under the age of 65 have a bunion, and over the age of 65 it's up to 36%. So that's pretty impressive numbers as far as how many people have this. Not everyone has pain though, because some people only have pain if they were to wear too narrow of shoes. So another treatment option you could say is to get wider shoes. But if you're having pain in the bunion and you think this is what you have, go ahead and stretch. Strengthen your foot, get some insoles and some wider shoes. And for most people that really helps, and if it doesn't, by all means see a podiatrist or a foot and ankle specialist.